All right. Uh-oh. Okay. In 3, 2. Springwoods Behavioral Health offers specialized treatment from a team of mental health professionals. This segment is sponsored by Springwoods Behavioral Health. We've got Jordan and Dr. Dollins here to share more about the work that they're doing at Springwoods, but also we're going to talk a little bit about back to school. Thank you so much for joining us today.
Thank you.
Yes,
Appreciate
absolutely.
it.
Jordan,
Appreciate
let's
it.
start with you. Let's talk about the work that you all are doing at Springwoods Behavioral Health.
Well, thanks for having me, first and foremost. I appreciate being back on the show and connecting with you all. As we talked about last time, we focus on mental health and working with patients of all ages. But specifically, we're here today to talk about adolescents and back to school. It's an important time for kids as they're getting back in and they're taking a look at what's going on in the community. They're facing different challenges than they faced over summer. And as a result of that, sometimes different things are going to take place and they're going to have different things that come to the surface and that they need to deal with.
Yeah, absolutely. Dr. Dollins, let's bring you in because to your point, Jordan, new school year, adolescents are experiencing some big feelings. What are some tips, Dr. Dollins, that parents can use as they're trying to help their kiddo through their mental health?
Was looking out for changes in their mood and behavior. Sometimes with things like depression or anxiety, it can come out in different ways than you might expect. Sometimes irritability or changes in their interest or enjoyment of activities can be a warning sign that they may need to have an assessment or see somebody for possibly getting into counseling or other treatment.
Sure. How would parents know if they need to maybe reach out to you all for an assessment?
Just asking them, just being upfront and being direct in approaching them, asking them if they're experiencing any difficulties that they think they might need help with.
And at Springwoods, you all offer an inpatient adolescent program. Is that right, Jordan?
Yes, we offer multiple levels of care at our facility. So we offer both inpatient, that's for more severe cases for patients that are really struggling, severe danger to themselves or others, suicidal ideation, or challenges that are more on the extreme level. But we do also offer partial hospitalization program. And so this is more of a day treatment program for patients that can come just kind of during for group therapy sessions for several hours, and they're not staying overnight at the facility. And we are actually expanding our services to offer outpatient med management as well. So our goal is to be able to offer all services under one system of care within the community.
Sure. Dr. Dollins, is there something common that parents may see in their kiddos, especially as school gets started, maybe as they transition from maybe middle school to high school?
Well, changes in their sleep patterns, their energy level, in their interest in activities, things that they normally would look forward to do or do for recreation or leisure. If they lose interest in those or don't seem as motivated to participate in those things as usual, could be warning signs that maybe they have some underlying mood problem like depression or anxiety.
Sure. And as parents are watching, if they want to reach out and they're like, you know what, I hear Dr. Dollins, I think my kiddo could really benefit from some services at Springwoods. How can they do that?
Well, you can give our facility a call and reach out, and we offer a no-cost assessment to all patients and all families at all times. So we're open 24/7, 365 without an appointment, so anyone's available to come in and get an assessment. And just coming into the hospital and getting an assessment doesn't mean that you're going to be going upstairs, right? It's all about finding the appropriate level of service and the appropriate level of care that is needed for the patient. And sometimes that can be no treatment at all. But we would much rather have parents and families bring their patient in, bring their son, daughter, family member, their kid in, and get them assessed rather than rolling the dice and not knowing. It's better to get direction, have an expert look at it, and there's no cost associated, so we're just here to try to help.
Yeah, good to know for sure, because we know back to school can be a very stressful time for parents and for kiddos as well. Where are you located?
So we're at 1955 West Truckers Drive, right there behind Sam's Club. Kind of by where the old drive-in theater used to be in Fayetteville.
Yeah, absolutely. Dr. Dollins, Jordan, thank you so much for joining us today. If you want to reach out to the team at Springwoods Behavioral Health, we'll make sure that we have a link over on our website. We'll be right back.